Complications of uveitis: cornea, scarring, neovascularization, calcific band keratopathy, with basophilic granules in Bowman's membrane. Anterior chamber, organization of hypopian or pertinacious exudates, retrocorneal fibrous membrane, peripheral anterior synechia or PAS. Posterior chamber, posterior synechia, seclusio pupillae, 360 degrees posterior synechia, occlusio pupillae, inflammatory pupillary membrane occluding the pupillary area. Secondary glaucoma, angle closure glaucoma, acute congestive glaucoma, secondary to ciliary body inflammatory swelling and anterior rotation of the iris lens diaphragm, posterior synechia formation with iris bombae. Open angle glaucoma due to inflammatory trabecular meshwork block and chronic steroid use. Iris, synechia, posterior synechia, peripheral anterior synechia, pupillary membrane, iris bombae, secondary angle closure glaucoma. Iris heterochromia, Fuchs heterochromic iridocyclitis, and new vessels of the iris, NVI. Uveitis may also be complicated by iris nodules, copy at pupillary border, Busacca within iris stroma, and Berlin in the angle, iris stromal atrophy or herpetic uveitis. Lens, anterior subcapsular cataract, posterior subcapsular cataract, total cataract. Ciliary body, cyclitic membrane, retrolental collagenous membrane extending from ciliary body to ciliary body, often results from organization and scarring of anterior vitreous. Contraction of the cyclitic membrane leads to detachment of pars plana and hypotony. Ciliary muscle remains adherent to scleras per attachment, and ciliary body pivots on attachment. Vitreous, posterior vitreous detachment. Organization of inflammatory debris may lead to cyclitic membrane and fibrous vitreous bands. Tractional retinal detachment. Retina, cystoid macular edema. Inflammatory mediators induce Muller cell edema versus retinal vascular leakage. The high prevalence in iris-supported intraocular lenses suggests the production of prostaglandins and inflammatory mediators by the iris. Uveitis may also lead to the following complications on the retina: reactive gliosis of retina, either pre-retinal fibrosis or subretinal fibrosis; intraretinal pigment migration, pseudoretinitis pigmentosa-like picture; chorioretinal scarring, hypertrophy, hyperplasia, and atrophy of retinal pigment epithelium; Drazin formation, abnormal basement membrane formation; fibrous and osseous metaplasia of the retinal pigment epithelium; collagen and basement membrane material deposition on Bruch's membrane; contains lacunae of retinal pigment epithelium, pseudoadenomatous proliferation; bone results secondary to dystrophic calcification in end-stage blind painful eyes. Common sites include peripapillary, ora serrata, Ring-Schweiler. Optic nerve, papillitis, optic neuritis, or papilledema. Complications of uveitis on the entire globe: atrophia bulbi, clinical phthisis bulbi, atrophia bulbi with shrinkage, rectus muscle traction on a hypotenuse globe causes a squared-off appearance. The appearance of the globe lacks disorganization. Pathological phthisis bulbi, atrophia bulbi with shrinkage and disorganization of intraocular contents. Globe is small, 16 to 18 millimeters, hypotenuse with thickened and folded sclera. There is generalized disorganization of intraocular contents. Cyclitic membrane and total retinal detachment is common. Numerous Drazin and osseous metaplasia of retinal pigment epithelium. Systemic effects of inflammation: acute phase reaction, fever, results from cytokines released from leukocytes. Cytokines, tumor necrosis factor, and interleukin-1 act on hypothalamic centers via prostaglandins release, inducing fever. High erythrocyte sedimentation rate. Interleukin-6 stimulates hepatic fibrinogen production, causing agglutination of RBCs. Leukocytosis. Interleukin-1 and tumor necrosis factor induce release of cells from bone marrow. Immature neutrophils release in blood. Shift to the left. Neutrophilia, high polymorph nuclear leukocytes in bacterial infection. Eosinophilia, parasitic infestation. Lymphocytosis, viral infection. Leukopenia, viral infection, debilitating disease.